My typical day on my current medicine rotation is to wake up at around 4:30 or 5, days start pretty early, and see the number of patients that have been assigned to me. On average, for a third year, it'll be 4 or 5 patients, and you chat with them, ask them how their night was, make sure their pulse is still there, and you make sure you get all the bits of information that your boss would like to know about that patient, and then you'll round with the team, including your residents and your attending, at around 8, and that'll last probably about an hour. So during that time, you're frantically scurrying around trying to collect all the information you can about your patients. That way when they ask you, oh, what was his blood pressure today? And how has that been compared to the last 4 or 5 days? You know. So as a student doc, it's really your responsibility to be the closest liaison for the patient to make sure we know everything about them.
So I wake up around 7 o'clock to get ready for class, or 6:30 or 7 o'clock, and our classes start at 8 o'clock. And we go from 8 o'clock until noon. We have 4 lectures in a day, roughly 4 lectures. It could be two hours or 4 1 hours, however they want to allot that time. And professors or physicians come in and teach us. And so we sit in the same room and they cycle throughout. And we just sit there and listen to them lecture. And then we have breaks in between each lecture. So each hour there's a 10-minute break. And then when it's noon, we're released, we have a lunch break, and some of us go home to study. I go to the library to study, and I'm usually there until the evening time, until I feel like I've gotten the information from that day's material. There's usually not enough time to review the previous day, so usually just focus on what you're doing that day. So I make sure when I'm going to the library to pack lunch and dinner, and then pack a change of comfy clothes, because I don't like to study in jeans or if I'm in my white coat. So I always bring like yoga pants and a sweatshirt to study in, which you can always see me with like 8 bags when I go. It's kind of nerdy, but it's comfy.
Our days begin in a small group learning environment where it's a group of 8 other students and myself and 2 facilitators, one being a clinician and one being a basic science faculty member. And we get a case for the week and we run through the pathophysiology of the disease, physiology, the pharmacology involved, so we can get a more well-rounded understanding of the material that we're going to learn in lecture. And then after that, we go to a lecture and we have a lecture based on the material that correlates with what we're learning in our small groups. And after that, some days we have an opportunity to work in a student-run clinic. And we have that once a week, and with that opportunity we're able to get a better understanding of what we're learning in an actual community environment.
So I walk out to my clinic site, whether that be at the university hospital or the local VA or even the county hospital down south about 30 miles. And I go in, and basically the day starts for me as I am as a medical student. I gather data from the patients that I've been seeing over the last few days or have been assigned to me the previous day. I talk to them, I ask them what's going on, I ask them how they're doing, I follow up on tests and anything else that's been happening overnight that I need to know about. And then following that, I round with the team, which is essentially a fancy way of saying that we meet up in front of the patients' rooms or we meet in our team room and we talk about what's been going on and what next steps that we need to take in order to advance their patient care and eventually get them out of the hospital and be on their merry lives. After that, we have usually something called morning report, which is where the residents get together and discuss a very interesting case. And it's a really nice way to learn about cases that aren't on your own caseload or on your own team. And it's also a way to sort of learn what a master clinician does in order to analyze, to be able to deduce, to be able to try and figure out what's been going on with these patients with more mysterious conditions. When you start out as a third-year medical student or a first-year clinical student, you can have anywhere from 1 to 2 cases per day, and you can follow along with those cases for as long as you need to. When you become a little bit more experienced, like a sub-intern, or starting to become more comfortable and feel like you can start doing intern-type duties, you can take 3, 4, and I've had friends who've taken 5 or 6 on per day on a primary basis. There are consult services that mainly will see 30 patients a day, and the student can take a vast number depending on how he or she feels is comfortable for them to take.
Being a first-year medical student is pretty fun. It's definitely a big transition period. So University of South Florida, their classes are set up so you have lectures usually in the morning. So I'll be at class from maybe like 8 to noon. So it's great for me. I'm a morning person, so I like that a lot. And then after that, you have a lunch break, which is fun because you can go to lunch meetings held by interest groups or hang out with your friends, and which is really great. Then after that, Mondays and Wednesdays, we usually have anatomy lab, which is by far one of my favorite parts of med school. We work with cadavers and we get to see a lot of cool things. One of my favorite labs we just had was the brain lab. So we got to see a real human brain and got to like cut through the skull and do all that fun stuff that you wouldn't have imagined that you'd get your hands on. And I'm only in med school, I've only been in med school for 3 months, so it's pretty awesome.